Hello everyone and welcome. I'm making this short video because many of my patients ask very similar question before starting their dental implant journey. It is completely normal to feel curious, excited, or even a little bit nervous when considering treatment. I often find that patients leave their consultation saying, I wish I had known that before I came in. So I thought it would be helpful to answer the most common question I hear every day in clinic. My aim today is simply to help you feel more informed, more comfortable, and more confident about the process. So let us get started. Question 1, I often been asked, what exactly is dental implant? This is usually one of the first questions I get asked. A dental implant is essentially a replacement for a missing tooth root. A small titanium pouch in place into the jawbone, and over time it bonds naturally with the bone. Once healing is completed, we place a crown, bridge, or a denture on the top to restore your smile and function. I often tell patients to think of it as creating a new foundation for a tooth. Question 2, does getting a dental implant hurts? This is probably the question I get the most. Is it going to hurt? Most patients are genuinely surprised by how comfortable the procedure actually is. The treatment is carried out under using local anesthetic, so you shouldn't feel pain during the procedure itself. Afterwards, you may have some mild discomfort, swelling, or tenderness for a few days. But many patients tell me afterwards, I was expecting it to be much worse. In fact, many compare it to having a tooth removed, and sometimes even easier. So don't be worried. Question 3, how long does the implant process take? This is another question I almost every day get. The honest answer is that it varies from person to person. Many patients understandably want treatment completed quickly, but implants are a process rather than a single appointment. Typically, treatment can take a few months because we need to allow time for healing and for the implant to bond naturally with the bone. If additional treatment such as bone grafting is needed, the timeline can slightly be longer. At your consultation, we will always give you a personalized treatment plan and explain what to expect. Question 4, am I suitable for dental implants? A lot of patients come in saying, I'm not sure if I even a candidate for implants. The good news is that most people are suitable. We look at factors such as your overall health, gum health, and the amount of bone available in the jaw. And even if someone has been told previously that the implants may not be possible treatment option, and techniques has been advanced significantly over the years, which make it possible for the most of the patient to get treatment done. Question 5, what happens if I don't have enough bone? This is actually more common than many people realize. Sometimes after losing a tooth, the surrounding bone naturally shrinks over time. If there isn't enough bone available to support an implant, we may consider procedures such as bone grafting or sinus augmentation to help create stable foundation for that implant. This is why detailed scans and careful planning are important to give you a predictable outcome. Question 6. How long do dental implants last? I love being asked this question because patients are often thinking long term. Dental implants are designed to be long-term solution. With good oral hygiene, regular dental checkups, and healthy habits, implant can last many years and often for many decades. I usually tell patients that implants are a partnership. We do our part and then maintaining them become a team effort. Question 7. Can implant fail? I think this is an important question to talk about very openly. Dental implants generally have very high success rates, but like any medical or dental treatment, there are no absolute guarantees. Certain factors such as smoking, poor oral hygiene, uncontrolled medical condition, or excessive pressure on the implant can increase the risk of complication. Our rule is to carefully assess and minimize those risks as much as possible. Question 8. Will my implant look natural? Many patients ask me, will people be able to tell this is a dental implant? The answer is, our goal is for nobody to notice. One of the main aims is to create a result that looks and feels natural. We carefully match the shape, color, and appearance of your replacement tooth so it blends beautifully with your smile. Question 9. How do I look after my dental implant? I sometimes hear patients saying, do I need to do anything special? The answer is actually very simple. You care for your implant very much like you care for your natural teeth. Regular brushing, cleaning between the teeth, and attending your routine dental visits. Good maintenance is one of the biggest factors in long-term success rate. I hope this video has answered some of the most common questions about dental implants and help make the process feel a little bit clear for you now. Remember, every patient is different and treatment is always tailored specifically to your needs. If you are considering dental implant or would simply like more advice, we have be very happy to help. Thank you very much for watching, and I look forward to seeing you soon.